New York Pause program that closed down schools, businesses, social distancing, and it's working. It is flattening the curve, and we see that again today. If we stop what we are doing, you will see that curve change. The number of patients hospitalized is down. And again, we don't look at just day-to-day data. You look at the 3-day trend, but that number is down. We have more capacity in the hospital system than ever before. So we've had more capacity in that system to absorb more people. The sharing of equipment, which has been really one of the beautiful, cooperative, generous acts among different partners in the healthcare system, has worked. If the hospitalization rate keeps decreasing the way it is now, then the system should stabilize over these next couple of weeks. But it's not a time to get complacent. It's not a time to do anything different than we have been doing. Remember what happened in Italy when the entire healthcare system became overrun? So we have to remain diligent. We have to remain disciplined going forward. Highest single-day death toll yet, 779 people. 9/11, which so many of us lived through, in this state and in this nation, 2,753 lives lost. This crisis, we've lost 6,268 New Yorkers. I'm going to direct all flags to be flown at half-mast in honor of those who we have lost to this virus. I don't think we return to normal. I don't think we return to yesterday, where we were. I think if we're smart, we achieve a new normal, the way we are understanding a new normal when it comes to the economy and a new normal when it comes to the environment. Now we understand the new normal in terms of health and public health. We have to learn what it means, global pandemic, how small the world has actually gotten, and understanding this phenomenon and having a new appreciation for it, how our public health system has to be prepared, and the scale to which we need a public health system. I think we've also learned positive lessons. We've found ways to use technology that we never explored before. Testing capacity, which we still have to develop. That is going to be the bridge from where we are today to the new economy, in my opinion. There's also lessons to be learned. Why are more African Americans and Latinos affected? You know, it always seems that the poorest people pay the highest price. Why is that? Why is that? We're going to do more testing in minority communities, but not just testing for the virus. Let's actually get research and data that can inform us as to why are we having more people in minority communities, more people in certain neighborhoods. Why do they have higher rates of infection? I'm going to ask our SUNY Albany chief, Dr. Javidan Rodriguez, to head an effort to do it right now. We'll do more testing in minority communities now, with more data research done now. So let's learn now. Department of Health will be doing it along with Northwell. We're also going to make an additional $600 payment to all unemployed New Yorkers. The federal government says they will reimburse us for it, but people need money now in their pocket. So New York will be doing that immediately. We're also extending the period covered by unemployment benefits for an additional 13 weeks, goes from 26 weeks to 39 weeks, so that should be a relief. By executive order, all New Yorkers can vote absentee on June 23rd, primaries coming up. Mercury Medical donated 2,400 BiPAP machines. They were brought up from Florida. Thank you very much, JetBlue, for doing that. I also want to thank Oregon and Washington State and California for freeing up ventilators. We're going to start a social media campaign. Who are you staying home for, right? It's not about staying home for yourself. Stay home for others. Stay home for the vulnerable people who, if they get this virus, are in a really bad place in life. Last point, our brothers and sisters in the Jewish community celebrate Passover tonight. Passover says we remember the past, we learn from the past, we remember the lessons of the past, we teach a new generation those lessons. But there's also a message of hope in Passover. And yes, this has been a difficult month. We'll learn a lot, we'll move forward, and we'll be better for it.
Governor Broadway said that it would be shut down until June 7th this morning. Is that going to be a good rule of thumb for other sorts of mass gatherings in New York City or statewide?
No, I wouldn't use what they think.
You anticipate mass gatherings beginning before June 7th?
I don't know, but I wouldn't use what Broadway thinks as a barometer of anything. Unless they're in the public health business and they have seen better numbers and models. All of these projections basically turned out to be wrong, right? And this is a very hard thing to model because besides all the variables, you're modeling public behavior and what people will do. If you go back and you look at even models that were put out in January, they all had a premise about how effective social distancing would be, what percent of the population would actually comply with social distancing, et cetera. And they have turned out to be wrong. But I think, Jesse, they can be wrong either way. You know, I'm more worried about people saying, oh, well, the number of cases is coming down. It's now safer. It's not. It's not. I'm more afraid of the number changing and the curve changing because people read something into it that's not there. If you reduce that compliance on social distancing, you'll see those numbers go up within days. Literally go up within days. So, no, I take it one day at a time, look at the data for the day, look at the numbers for the day, and then make a decision. We extended everything until April 29th on the school closing New York pause. Even that's a projection. I wouldn't go past that.
There are other places where we haven't seen these cases. Do you foresee opening schools, opening...
You haven't seen these cases yet, Jimmy, and be careful of tense. We are in the midst of this. Don't start doing a retrospective like it's over, because that's the attitude we have to avoid. You will see more cases in upstate New York. I'll bet you whatever you want to bet right now. You will see more cases on Long Island. I'll bet you whatever you want to bet right now. So we're not through it. It's not over.
What would be the tipping point, so to speak?
Look at the infection rates, Jesse. That number has to come down on the other side of the mountain. The number of new cases going into a hospital, the infection rate has to come down to a point where you believe the isolation of the vulnerable, the other measures we're taking, is enough to start to reopen. And then how do you reopen? It's not just going to be about Broadway theaters. Before you go to Broadway theaters, people are going to say, when can I go back to work? When can I go back to school? When are the other essential services going to open?
It wouldn't need to be zero, is what you're saying. It could just be low enough.
Yes,
that, right.
Yes. I don't think it has to be zero. I don't think it, look, it may never be zero. It may never be zero. You think there's ever going to be a morning that I wake up again in my life not worried about this in the back of my mind? You don't think we're all going to worry about now, is there a second wave? You don't think we're all going to worry about now when somebody sneezes in Asia, how long until that cold comes here? You've seen 4 or 5 days of flattening. Oh, it's flat. No. you have 4 or 5 days of flattening. You could have tomorrow morning we wake up and the number is back up. So I'm not willing to say, because it's not true, that any of this is over or anything has been accomplished, because this is just a small snapshot in time where we are. At this rate, we are below projected numbers. Nobody is saying we peaked. We have flattened the curve. For this period of time, if you continue doing what you're doing, might one think the flattening would continue? One might think that. But nobody knows.
Are you worried about undercounting in terms of people that may have died at home and not been diagnosed with COVID-19?
I think that's a very real possibility. The question is, if people died at home, might you not have those numbers because they would only come from basically a funeral home? We're looking at other models because right now most of the data we have comes from hospitals and major institutions, nursing homes. So there could be a deviation, no doubt about that.
Do you think that New York was late to act?
No, I think New York was early, and I think the actions we took were more dramatic than most, and frankly, were criticized as being premature. But no, I think, look, if anything, in retrospect, it shows what we did is right.